I'm Dr. K. Hari Prasad, President of Apollo Group of Hospitals Division. And I'm also the Executive Chairman of Society for Emergency Medicine India. Emergency medicine is a relatively young specialty in the country. It did not exist before 1999, or you could call it a specialty of the current century. In 1999, we had the first conference of emergency medicine in India at Hyderabad, where about 50 to 100 people gathered, and we had a lot of support from international faculty who came down, and that's how the whole thing began, and the Society of Emergency Medicine emerged from there. There were no training programs, the specialty was not recognized by the government of India, and so there were no emergency specialists. In those days it used to be called casualty, and people who passed MBBS used to be manning them, and most often they used to function as post offices. That is, if an emergency comes into the hospital, they used to call the appropriate specialist for treatment, and it used to be more of a post office because this was basic MBBS doctors without the required skills of an emergency physician. Now, we started emergency medicine training programs with the help of US and UK faculty and institutions, because they were far more advanced at that point of time, and they were doing a great job. So we thought it was the right thing to do. But also what we did was, over a period of time, we understood that what works really well in the US or UK or in some of the other countries need not fit into our culture and society and our way of functioning in terms of the healthcare. So we actually Indianized a lot of what we got from US and America, and made sure that it was practical, workable and doable in this country, and people would benefit from it in this country. So I'm very, very happy that over the last 20 years significant progress has been made. Today we have the Medical Council recognizing the specialty. In 2009 it was recognized as an emergency medicine as a specialty, and then subsequently started MD and DNB programs for emergency medicine in this country. And apart from that, there are other educational programs which are happening in collaboration with Royal College of Emergency Medicine in UK and some universities in the US. So there are a number of emergency physicians who are coming up, and recently our Prime Minister, Shri Narendra Modi, actually took up the cause of emergency medicine and said that every large institution must have an emergency department and should provide optimal care to the emergency victims. And that's a huge call for the specialty. And for this we need a large number of trained personnel. It's not enough to be trained in one specialty. An emergency physician needs to be able to handle every emergency belonging to every specialty, and should be able to provide optimal care during the golden hour. The golden hour is the initial period after an emergency or an accident, and the quality of care provided during that golden hour often decides between life and death of an individual. So we cannot wait for a specialist to come or a super specialist to come for treating a heart attack or an accident victim. The emergency physician is fully equipped, fully skilled to handle these emergencies, and the outcomes are much better when the patient presents early and is handled by appropriately trained emergency physician. And that's beginning to happen in India. We've come a long way, but we still have a long way to go. The strength is the youngsters who have taken up to the specialty. At least till 2009, there were a lot of people who were taking up the specialty, youngsters, not knowing their future because it was not yet recognized by the Medical Council of India. And today they form the nidus around which the entire specialty is being built. So actually the credit goes to these youngsters who took it up initially in the first 10 years. And they continue to work for the specialty, and they continue to build the specialty. What started as a Society for Emergency Medicine in India with about 50-60 members, today has over 5,000 members across the country. And I believe that we train about 1,000 emergency physicians, all programs put together, and some of them are recognized by the Medical Council, some not recognized, but that doesn't really matter as long as the individual gains the skill to handle emergencies. That is more important. And we believe that the country needs over 100,000 emergency physicians immediately if the Prime Minister's vision of starting emergency departments in all large hospitals has to take shape. But we don't have that. So we need to definitely enhance the number of training programs in the country. And for doing this, it would not be enough for the current pace will not take us anywhere. I think the pace at which we are going is a routine pace, and it is similar to what would happen in internal medicine or general surgery or cardiology, where we've been having training programs for decades and we've had enough workforce in the country. Emergency physicians are a real shortage in the country, and I believe that unless we start training programs in collaboration with multiple institutions, in partnership with multiple institutions, and start licensing them, even if it means relaxing some of the archaic rules and regulations that our country has, and getting youngsters into the field and getting them to work and empowering them. Today what's happening is a lot of students who pass out of emergency medicine and specialize as emergency physicians are actually going abroad, because there is a severe shortage of emergency physicians, not just in India but across the globe. And you would not believe that at least there's a program that we run with the Royal College of Emergency Physicians, and at least 50 to 60% of those who graduate go away to the UK and start working there, because there's so much of demand there and we're not able to retain them here. So I think significant enhancement in the number of programs, if required, relaxation of some of the rules and regulations to encourage and empower youngsters to take up the specialty in a big way. And third and most importantly, to create the emergency departments with the technology and the infrastructure that is required to provide optimal care is very much essential for the country. And I think we are beginning to move in the right direction, and one has to wait and see how quickly we would reach a stage where we could say that we are providing optimal care across the country. The other challenges are really, I think the biggest thing is the response time and awareness in the general population, because an emergency you really don't know when it happens, how it happens. And when it does happen, one needs to get access to quality care immediately if the outcome has to be good. Now, the real challenge which we see is people either do not know what an emergency is, where, for example, a chest pain is often taken off as a gastritis or something like that, and people delay reaching a hospital. And even if they know that it's an emergency and they need to reach an hospital, they do not know how to reach a hospital. And our ambulance systems are in some form in 108 or 1066 belonging to private hospitals like Apollo are functional. But I think there are a lot more that needs to be done on the pre-hospital emergency part of it, where immediate access is available to the doctor, to the emergency victim. That's one area where a lot of work has to go in. And the second area is, then there's no point in taking an emergency victim from the spot, doing a fantastic job in resuscitating him on the way, and taking him to a hospital which does not have optimal facilities. So developing emergency departments within the hospitals and networking them appropriately with the pre-hospital emergency system is the next thing which needs to be done on a priority. And all emergency departments are not going to be the same level of departments in terms of skill and technology and infrastructure. So we need to grade our emergency rooms and make sure that the right emergency victim reaches the right emergency room, to make sure that optimal care is provided and time is not wasted in shifting the victim from one hospital to the other. This actually could mean the difference between life and death. And there's a broad estimate that over 1 million deaths happen in this country because of suboptimal care during the golden hour or golden hour. And I think this number of 1 million is understated. I think it will be multiple times that. I think it's exciting times for emergency medicine in the country. The world has recognized that emergency medicine has been established in the country and is moving ahead. And this conference that we are at, which is the Asian Conference of Emergency Medicine, is being conducted for the first time in India, after exactly 20 years after the specialty began in the country. And I think we've been able to exchange a lot of notes, We have faculty from all over the world at this conference. We've been able to learn best practices from different countries, and we've also been able to create awareness in the regulators, in the ministers or in the powers that be, and also in general public about the importance of the specialty and what difference it could make to individuals and to the community in terms of an emergency, which really will happen, but no one knows when it will happen and to whom it will happen.